This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Abhijit Lodeng. The headlines. Group of Ministers reviews current status and actions for management of COVID-19. More than 1 lakh PPEs and N95 masks being manufactured every day in the country. Interministerial central teams take stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. NAFED to distribute about 6 lakh metric ton pulses to nearly 20 crore households for 3 months under Prime Minister Garib Kalyan Anna Yojana. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. The group of ministers, GOM, in its high-level meeting today, reviewed the current status and actions for management of COVID-19. It was the 13th meeting of GOM in New Delhi, in which a detailed presentation on the status of COVID-19 in the country, along with the response and its management, were made. The GOM had a detailed on the measures taken as on date by the centre and various states and union territories for prevention, containment and management of COVID-19. The GOM was informed that all districts have been asked to follow and further strengthen their contingency plans to combat COVID-19. It was briefed on the state-wise details of dedicated COVID-19 hospitals along with the adequacy of isolation beds, PPEs, N95 masks, drugs, ventilators and oxygen cylinders. The GOM was informed that domestic manufacturers which have been identified earlier have already started the production of PPEs and masks and at present the stock is available. It was informed that more than 1 lakh PPEs and N95 masks are being manufactured every day in the country. There are at present 104 domestic manufacturers of PPEs and 3 making N95 masks in the country. In addition, production of ventilators has also started and orders have been placed for more than 59,000 units through 9 manufacturers. The GOM also reviewed the testing strategy and availability of testing kits across the country along with the strategy for hotspots and cluster management. The GOM also deliberated on various tasks assigned to various empowered committees and presentations were made. It was apprised that around 92,000 NGOs, self-help groups and civil society organizations are working and contributing by providing food to the migrant workers across various states. These NGOs are supported by the states by allotting funds from State Disaster Response Force, SDRF, and by Food Corporation of India, which is providing the food grains at subsidized cost. The GOM was also informed that a national level metadata of health workers, doctors, NCC and others has been prepared and shared to all the states, districts and other officials to mobilize the resources and COVID warriors to much needed locations. There is presently data of more than 1.24 crore human resources on the dashboard. These COVID warriors are being trained through online platforms and so far more than 10 lakh personnel have been trained. The GOM was also apprised that as of now, the death rate is around 3.1%, while recovery rate is more than 20%, which is comparatively better than most of the countries and may be taken as a positive effect of the lockdown in the country, along with cluster management and containment strategy. It was said that the average doubling rate of the country is 9.1 days as of now. During the meeting, the chairman of the GOM and Union Health Minister Dr. Harshvardhan commended the dedication and hard work of all the stakeholders at all levels. He informed that in view of the urgent need for addressing the issues of stigma and discrimination of patients and also the healthcare workers combating with COVID-19, the Ordinance for Amendment of Epidemic Diseases Act 1897 has been recently promulgated with very stringent provisions. Civil Aviation Minister Hardeep Singh Puri, External Affairs Minister Dr. S. Jaishankar, Minister of State for Home Nityanand Rai also attended the meeting.
New interministerial central teams constituted by the Ministry of Home Affairs today took stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. In Telangana, the interministerial central team, which reached Hyderabad earlier in the day today, took stock of COVID-19 pandemic situation in the capital city. The central team, led by Additional Secretary in Jal Shakti Ministry Arun Baroka, called on the State Chief Secretary Somesh Kumar and visited the Telangana Institute of Medical Sciences and Research at Gachibowli. Our correspondent says the team inquired about various aspects like observing of the lockdown, following pandemic protocol, treatment of COVID-19 patients, among others.
A day after its constitution, the 5-member central team has begun its assessment about the preparedness of health sector in combating COVID-19 in Hyderabad, where high number of corona positive cases are being reported. The team called on State Chief Secretary Somesh Kumar to know various initiatives that the state authorities are implementing to contain spread of coronavirus. The central team went round the newly set up 1,500-bedded COVID treatment facility at Gachibowli and inquired all the details from the health staff and gathered information from the medical officials about medical care being taken in the hospital. The team will also share its expertise with the state officials for effectively tackling the pandemic, besides meeting the DGP and visiting GHMC control room tomorrow. Lakshmi, AR News, Hyderabad.
The Interministerial Central Team, led by Additional Secretary in the National Disaster Management Authority, Dr. V. Tirupazag, reviewed the arrangements today in Chennai to contain the disease spread. Meanwhile, in Tamil Nadu, 94 patients were discharged today from hospitals, while 66 new cases have been confirmed. One person died of the disease, taking the toll to 23. More from our correspondent.
The Interministerial Central Team began their assessment of the ground situation by reviewing the overall measures to contain the spread with the State Chief Secretary and other senior officials. Later, they met the Chennai Corporation officials and took note of all the containment activities, testing and treatment facilities and the relief measures, besides the actions being taken to ensure the lockdown conditions. They also visited a quarantine facility at Thondayarpet in the city. Tomorrow, they are planning to see for themselves the sanitary and social distancing measures being followed in Coimbatore market in the city, which is touted as one of Asia's biggest wholesale markets, dealing with food grains, vegetables, fruits and flowers. Meanwhile, the state has improved its COVID-19 patients discharge ratio to 52.7%. Jai Singh, AR News, Chennai.
In Gujarat, 2 interministerial central teams reviewed the COVID-19 situation in Ahmedabad and Surat today. Our correspondent reports that the teams held meetings with the district collectors and police officials in both the cities and took stock of the steps taken by the police and the administration in view of COVID-19.
The teams headed by Additional Secretary held round of meetings with senior officials including collectors, civic chiefs, police commissioners in Ahmedabad and Surat. District collectors and commissioners of police briefed the members on the steps taken by them to contain the spread of COVID-19. Ahmedabad team also visited Gandhinagar and held talks with Chief Secretary and other higher officials. Surat team also held talks with Chief Secretary Anil Mukim through video conferencing and discussed the issue of migrant work